The number one reason patients are unhappy after cataract surgery isn't the lens they choose. It's actually their tear film. Dry eye, or an unstable tear film, can blur your vision, distort your preoperative measurements, and even make the best lens choice look like the wrong choice. In today's video, we dive into how dry eye affects cataract surgery results, why it's so common for cataract age patients to have dry eye, and what you can do to prepare your eyes for surgery to get your best result and the absolute best vision possible. Now real quick, before we start, my name is Brad Sifrig. I'm a board certified cataract surgeon, and this is Cataract Companion, the patient guide to cataract surgery success. If you are a loved one or getting ready to have cataract surgery, then you're in the right place. This channel is dedicated to helping patients better understand the surgery process and get their best results. Now, as always, I have no financial disclosures. Cataract Companion takes no money from any lens companies, and our videos aren't sponsored. With that, let's jump into it. So dry eye disease is extremely common, and it goes by many names. You may have heard terms like ocular surface disease, aqueous deficient dry eye, evaporative dry eye, tear film dysfunction, meibomian gland disease, blepharitis. In the medical literature, we often call it keratoconjunctivitis sicca. Despite all of these many names, the important thing to understand is that all these terms involve the health and stability of the tear film. Let's quickly run through some of these subcategories of dry eye. So ocular surface disease is just kind of a general term that's synonymous with dry eye disease. Aqueous deficient dry eye means you don't make enough tears, whereas evaporative dry eye means you make enough tears but they're evaporating too quickly. Now, tear film dysfunction means that the balance of fluid, oil, and mucus in your tear film is not healthy or unbalanced. Meibomian gland disease, or MGD, means that the glands of the eyelids that secrete oil into the tear film aren't flowing well and aren't working well. Finally, blepharitis means that there's some inflammation at the edge of your eyelids. Blepharitis often goes hand in hand with meibomian gland disease because that's right where those glands are located. As you can probably guess from the fact we just went through 8 different types of dry eye, the tear film is an incredibly complex system. A healthy tear has a mix of 3 main components within the tears: the aqueous or fluid portion, mucus, and oil. Beyond the tears themselves, the ocular surface relies on having normal, healthy epithelial or surface cells on the cornea and conjunctiva, as well as normal eyelid structure and function. If any component of this complex system is unhealthy, it can lead to a cascading effect that causes the other parts to kind of fall apart and leads to the symptoms or signs of dry eye. Dry eye disease in general is incredibly common, and it becomes even more common as we get older. Looking at the cataract age group, this study at Duke and Cornell actually showed that 80% of preoperative cataract patients had at least one sign on exam or one positive test for dry eye disease. Now, many patients in this study had never been diagnosed previously with dry eye disease, and actually many of the patients that had signs of dry eye weren't having symptoms at the time of their preoperative visit. So on that note, what are the common symptoms that can happen with dry eye? Well, the most obvious one is the eyes feel dry or irritated. Oftentimes this can feel like there's sand or grit or debris in the eye. Sometimes patients will tell me they feel like when they blink, the eyelids are like sandpaper over the surface of their eye. Another common symptom, maybe even more common than the feeling of dryness, is some intermittent blurring or fluctuation of the vision throughout the day. Because cataracts are constant, they don't change throughout the day, they just cause a baseline level of blur. So if the vision is fluctuating throughout the day or when you do different tasks, it's much more likely that's coming from dry eye disease. This fluctuating vision or this occasional blur in vision oftentimes gets worse when we're on the computer, phone, or when we're reading, because we actually blink less when we do those activities. A lot of times I'll also find that dry eye can get worse throughout the day because the eyes tend to dry out with use. This is especially true if you're in a demanding occupation where you're using the computer or reading a lot throughout the day. So if dry eye is so common, why is it often not diagnosed until the time of cataract surgery? Well, probably the main reason here is that dry eye can often be asymptomatic or only mildly symptomatic, where a patient has dealt with it for a while but never really gotten a formal diagnosis. Because cataract surgery and the cataract evaluation process is often the most thorough eye exam a patient's had at any point in their life, getting a second diagnosis, especially a second diagnosis like dry eye, is actually very common. Surgeons who are really astute in looking out to get their patients their best results during cataract surgery will diagnose dry eye disease when they see it, because it's really important to treat and control the dry eye before the surgery itself. What are the treatments for dry eye? A lot of it depends on what subtype of dry eye you have or what the underlying etiology might be. So if you have aqueous deficiency where you're not making enough tears, oftentimes the treatment may be using artificial tears, whether they're preservative or preservative-free, or even doing punctal plugs that prevent the tears from being moved away from the eyes. Most of the time there's an inflammatory component to dry eye, so low potency topical steroids might be used. There's also anti-inflammatory drops that are a little safer long-term, things like Restasis or Xiidra. For problems that are more localized to the eyelids, like blepharitis and MGD, the most common treatments are warm compresses, lid scrubs, sometimes oral antibiotics like doxycycline, or localized ointments like erythromycin. And for severe dry eye, there's treatments that go beyond this, including serum tears, scleral lenses to help provide a tear layer over the eye, things like amniotic membranes to encourage better surface health. There's also some in-clinic treatments we can do like IPL or like meibomian gland expression that help to get the eyelids working a little bit better. Regardless of what the underlying etiology for your dry eye might be, it's very important to treat the dry eye in order to get your best cataract surgery result. So many studies have shown that treating dry eye preoperatively improves the measurements that we get, which in turn means we're able to pick out a more accurate lens for your eye. One particularly good study looked at patients with dry eye before cataract surgery and showed that a short course of steroid eye drops, anti-inflammatory eye drops, eyelid scrubs, and warm compresses led to better, more accurate measurements when picking out a lens for surgery. And really, this is the regimen I like to use with my patients to prepare their eyes for cataract surgery to help treat that dryness and get better measurements. That being said, there's a lot of different studies that have shown different regimens may help, so it's going to be a little independent to each surgeon. One thing I was actually surprised to find was this study in the research that showed just increasing artificial tear use actually didn't improve measurements in patients with dry eye. I say that surprised me because that's probably the most common thing that cataract surgeons do. When they see dryness, they say, just increase those tears a little bit before the surgery. And admittedly, that's something that I used to do as well. But really the science shows that that's not enough, that a little bit more intensive of treatment is needed to get that improvement in those measurements. So with cataract surgery, again, it is essential to treat that dry eye before cataract surgery to get your best measurements. You also really need to plan to continue to treat the dry eye after surgery. Now, cataract surgery itself really doesn't tend to make dry eye any worse. Sometimes it can for a month or two, but pretty quickly patients get back to their baseline. But because we're introducing a new optical system or a new lens to the eye, it's really important to optimize the rest of the eye to help that lens work its best. And on the topic of lenses, what lenses are a good choice for cataract surgery patients if they also have dry eye? In case you don't know, during cataract surgery, we're removing that clouded natural lens in your eye. That's what the cataract is. And since we're removing that lens, we replace it with a new clear lens. Nowadays, we have different types of lenses that can do different things with your vision. And really, what lens you choose will determine how much range of vision you'll have after surgery and how dependent you'll be on glasses. If you want to learn a little bit more about the different lens types during cataract surgery just in general, check out this video I made that kind of goes through the different subcategories and how they can affect your vision. I also have made a digital lens guide that you can download totally for free just by scrolling down to the link in the video description below. Now for patients with mild dry eye, really all of your options are on the table, including single range lenses, toric lenses, or extended range lenses like EDOF and multifocal lenses. If you're thinking you want to do one of those extended range categories, I think it's essential for you to complete some dry eye treatment before surgery and to be willing to continue to do that treatment after surgery. If you think you're going to have trouble maintaining a long-term treatment plan for dry eye, then I would avoid those multifocal IOLs as they're the most sensitive to the symptoms of dry eye. Unfortunately, there's no cure for dry eye disease, just management, and a lot of it has to become part of your daily routine, just like brushing your teeth. Now, if you have more moderate dry eye, again, I probably recommend against the multifocal lenses at this point, but I think monofocal plus lenses or extended depth of focus lenses are still on the table on a case-by-case basis. But again, it's going to be essential for you to continue to treat the dry eye even after surgery. In patients with really severe dry eye that are requiring multiple prescription medications or intensive treatments for it, really at that point, those extended range lenses may not work as well, and I tend to just recommend a single range monofocal lens to try to get the distance vision into good focus. So thank you so much for watching. I hope this video has been helpful on your journey to better vision. If you or a loved one are getting ready for cataract surgery, make sure to subscribe to the channel for more helpful videos, and I'll see you in the next video.